Welcome back to the Case Area 3 Experience here at the Arden Fair Mall. Today we're talking about new ways to have your eyes checked, and these days it seems like there's another surgery to improve your vision and new ways to try to diagnose exactly what your problems are all the time. And Dr. Brent Reed is here with us again today. You brought your latest toy that you have around the office.
Yes, I have.
Now, what is this thing?
This is called a pachymeter. This is an instrument that we use to measure the thickness of a person's cornea.
Okay, and that's useful because?
Well, in laser surgery, it's really critical that we make sure that the corneal thickness is adequate to safely do the surgery. And this instrument will bounce a sound wave off a person's cornea 25 times in 2 seconds, give us a corneal thickness and a standard deviation of those measurements all at the same time. Plus, it's become increasingly important to figure out how thick people's corneas are in relationship to how high the pressure in their eye is, which relates to glaucoma.
Do you feel that at all when it's done?
No, you
because
can't
some
even
of the
tell.
Things in your office, especially that little puff of air, not so pleasant for a lot of people.
We really don't use the air puff mostly in an ophthalmology setting. We do more contact tonometry work, and the numbing drops we use actually work so well that you can't even feel any of this. People say, "What did you just do?" I saw the light move, and I said, "I just touched your eye with this."
And they're not even aware.
And they're not even aware we did that.
So this is, in addition to the glaucoma screenings, very useful for the laser surgeries, which have, over the last 10 years become so dominant in your field. Does this help predict who's going to be a better candidate? Because there are some people who have the laser surgery and for whatever reason have become part of the failure rate.
Yes. This actually helps us go ahead, I'm sorry.
I'm sorry, but it helps you figure out who's a good candidate.
It does. It really does help us determine whether or not someone is a good candidate. If their cornea is too thin, it eliminates them from the possibility of being able to have accurate and predictable corneal refractive surgery. So we actually probably eliminate about 1 in 20 people after they've had this test alone because they're not good candidates based on that alone.
Because there's some people who think that anybody can have the surgery, and that's not the case, is it?
That's absolutely false.
Right.
It takes a fair amount of screening, usually about 2 or 3 hours of testing, to make sure someone's a good candidate for this.
Are there age limits on it in terms of how young someone can be to have laser surgery these days?
You really don't want to do young patients who have not finished maturing physically, and 18 is the minimum age. We don't go below 18, and typically we don't want to do young people, even 18 to 25, until they're stable.
Because your eyesight is still changing
exactly.
So much. And then what's the upper age?
Well, the upper age, really, there is no upper limit as long as the eye's healthy. It's healthy. It's the health of the eye that really determines that. The problem is, as we get older, we tend to have more eye disease.
This is true.
So we screen people very carefully for that. But I think the oldest I've done is an 84-year-old patient.
Okay. Well, thank you very much. I'm glad to hear you don't do that eye puff thing anymore.
No, we don't do that.
I hated that. Thanks, Doc.